Hello, everyone. Welcome. Today we have
Hello.
Dr. Jaideep Chandra with us for REACHA Dialogues. Firstly, thank you so much for your time, sir, for coming here and being a part of this. I would start quickly by giving a quick introduction about Dr. Jaideep. Um, Dr. Jaideep has done his schooling from the Martinia School in Lucknow, and then he went on to study from GSVM Medical College in Kanpur. And then after that, he joined IMS BHU Varanasi. And once he was done with his studies there, then he completed his studies from SGPI Lucknow. He has been practicing neurosurgery for the past 20 years now. So firstly, thank you so much again, Doctor, for coming in. Quickly, I'll give you a quick introduction about the blog and the intent and the purpose of it. So the reason why we started REACHA Dialogues was to basically create a medium as to where we can get people from different backgrounds with different life stories and life journeys, where they can come and share their learnings, which can help people like us, people who are younger, listen to your stories, your learnings, and in some way, if we can incorporate that to make our lives more meaningful and have a purpose to it so that we can be happy, and also at the same time understand the importance of giving in our personal and professional capacity. Um, so, sir, we'll start with some of the questions and then we can take it from there. So, sir, as a doctor, you've been a doctor for, you've been doing neurosurgery for more than 20 years. And as a doctor, you have so much responsibility on your shoulders. How do you cope up with that kind of pressure where there is no room for mistake?
You see, it comes from practice. Neurosurgery is a branch which requires a tremendous amount of precision,
Yeah.
not only while executing surgeries, but also while performing. Not only while performing surgeries, but also while diagnosing a patient. For example, you cannot choose a patient who because all neurological and neurosurgical patients will present with similar symptoms. So you have to choose which one you have to operate, which one you can't operate. You cannot make a wrong decision over there either. So it comes with practice, and there are two things which a neurosurgeon goes through. The initial thing, which most of the residents and people coming out fresh in the practice feel, is fear when they are handling a patient. Fear is also, if you train yourself correctly, then the fear will train you to perfection, because you are afraid of touching unnecessary things, especially during surgery. If you make one false move, your patient will end up in a great amount of trouble. So the fear guides you. The fear guides you initially, that the lesser you do, the lesser the harm you will bring upon your patient. And later on, with practice, it turns into confidence when you are sure of what you are doing. So you have to use both the tools correctly, fear and confidence. But if you are not using your if you're using your confidence too much, you will be harming the patient. If you're using the fear too much, you will be doing less than required for your patient. So it has to be always has to be a balance of fear and confidence.
So is there anything that you also do outside practicing surgery or when you're in the hospital to, make sure that you can get the balance between fear and confidence, right? Like, is there any other thing that you practice at home? Or,
Uh, a thing which has helped me a lot is yoga meditation, especially pranayama. It helps me to focus correctly and exactly. It also helps me to soothe my nerves. For example, if I am going to perform a surgery which I have not performed often, but I have to do it, and the amount of trepidation and palpitation which a surgeon goes through is immense. To control that, meditation helps me a lot.
okay, sounds good. And then in a scenario, sometimes when you're dealing with a patient, say for a long time, uh, one can have, like a room to develop emotions, like with that patient, like you start developing care or just you have like something like a soft touch for them? Like if you're seeing the patient and if you know they're steady for a long time, uh, does this happen to you, or how do you manage to avoid developing emotions, say for uh, patients you're working with? And if you do develop emotions, like how do you deal with them so that it doesn't affect your work with them?
See, there are two terms which we use. One is sympathy and the other is empathy. And we are trained to have empathy for a patient, not sympathy. So once you start showing sympathy for your patient, you will develop troubling emotions. The emotions will not help you make the correct decisions.
Okay.
So we are trained in a way where we do not sympathize with the patient, but we empathize with the patient.
Okay.
And it's a part of training, it's a part of medical training, uh, which deals with looking after patients day in and day out.
Yeah.
And you have to keep yourself emotionally aloof.
Okay. Sounds good. So directing our conversation a bit towards COVID, because COVID-19 is a big thing that's happening in India right now, and people are battling the disease. So some of the points that I would like to seek your guidance on. Firstly, do you think does fitness help us fight diseases like COVID? And can you, in layman terms, explain what exercising does to our body and how it helps?
Yes, a very good question. See, any form of physical exercise, any form of physical exercise will help you, always help you to boost your immune system. Now, we are talking about many things which can boost our immune systems. Most of these do not work the way you think they work. Even your immune system is not a machine which can be triggered on and off. See, the immune system needs an antigenic challenge. Only and only when it has an antigenic challenge prior to the infection in question, your immune system will recognize it and fight against it. Otherwise, all your immune responses may be haywire. For example, in COVID-19, you are having a pretty strong immune response which is destroying the body itself.
Yeah.
See, it is not the virus which is killing you, it is your own immune system which is killing you.
A lot of
In
time.
order
Yeah.
to have a good, I would say that immunity is a backup which you have. So, in order to have a good backup for your immune system to work properly, you should have a balanced diet. And I will explain what a balanced diet would be a little later. And good exercise which keeps your heart healthy. Now, how does the exercise help you to keep a good backup for your immune system? See, when we are at rest, a lot of the white blood cells, which is the first line of defense against any invading pathogen, they are lined up against our blood vessels and they are dormant. They are not available for action. Once we start running or exercising, the blood flow increases and all these white blood cells which are lined against the blood vessel walls will come into the main circulation. So that is the first way in which exercising helps activate the immune system. And the second is it keeps your hearts and lungs in a fighting fit condition. To fight this COVID virus infection, you need a very fit lung and you need a very fit heart. If two of these organs stay with you till the end, you will win any battle against COVID. But if they fail, if your lung fails, if your heart fails, then no amount of medical intervention is going to help.
Since you mentioned the importance of keeping lung and the heart healthy, and earlier also you mentioned that you practice pranayam, do you think pranayam is something that can also help uh, develop strength for lungs, and that can eventually help against COVID?
Exactly. Pranayam not only helps keep your mind focused, it does not only helps to develop your concentration. Pranayam is a breathing exercise. If done correctly, it helps to increase your lung capacity. It also helps to slow down your heart rate. So once your lung capacity is developed beyond the normal, you can hold your breath, let's say up to 5 minutes, 10 minutes, 15 minutes. A normal person can only hold his breath for about a minute, maybe a minute and a half. Only underwater swimmers can hold it for maybe a little longer. But if you do pranayama, you can train yourself to hold your breath for much longer period. You can even bring your heart to a stop and will it on when you want.
And just
To
to
achieve
yeah,
to achieve that level of concentration, it requires a lot of practice. I can't devote that much of time, but
yeah.
whatever time I've been devoting to pranayama has helped me to increase my lung capacity, slow down my heart rate, and develop my focus.
Okay, sounds good. And then where do you think would we fit in the importance of good food, nutrition, and staying healthy, balanced diet in all of this?
See, for immune system to function, in fact, for any system to function inside the body, they have their own set of requirement of micronutrients. The micronutrients are those substances which are available in diet or as dietary supplements or as tablets. So if we keep a healthy and balanced diet, and now a balanced diet means that you have to have the right amount of right proportion of fats, carbohydrates, and proteins in your diet. Choose from your seasonal food which is available to you in and around you, because nature has created them in such a way that you get your all micronutrients, your calories, your protein, and your fat requirements from the available natural resources. So you have to choose from your freshly available seasonal fruits, vegetables, and of course, if you're not vegan, you can also choose between a variety of fish and poultry.
Yeah. And a lot of times, younger people, at least personally myself too, we sometimes tend to go for easier options in terms of food, which include lot of like fast food restaurants. And then do you think fast food restaurants and like food from there play or might play like a negative role um, in terms of giving you not the right nutrition, and then that um, impacting your body? Because I think it's critical to understand what food we are taking and what is going inside our body, so that um, it's at least it's healthy and getting nourished.
Yes, this is also a good question. See, there you can eat anything you want and whenever you want, as long as it is palatable. But uh, eating anything in excess, which is not required by your body, is definitely going to harm you. For example, in your fast food, these foods are of high glycemic index. It means that they contain substances which increase your blood sugar. Your blood sugar triggers the release of dopamine in the brain, and the dopamine triggers your pleasure centers, which means that if you are taking foods of high glycemic index, you get addicted to them. Obviously, if you are taking foods of high glycemic index, you will gain weight, your sugar will shoot up, and that is not good for health. As long as you can keep a balance between eating fast food and eating food at home, which is home cooked, from your seasonal vegetables and fruits which are available to you in that season, in that geographical area where you are living, you will have always have a balanced diet. If you only eat fast food, if you don't eat fresh fruits, if you don't eat homemade food, then it is going to harm you, definitely.
Okay, yeah. As a frontline worker who has been consistently going to hospitals for work through the pandemic and even continues to, can you walk us through what you saw initially when this pandemic started, and what were some of the things that you told people who were worried and undergoing treatment earlier, as we didn't really know much about the disease then, and now also slowly we are starting to get to know more about this virus?
Okay, see, initially nobody knew how this virus is going to affect our body, and nobody knew how to treat um, the symptoms caused by it. So we were waiting in the dark, and after some time, things became clear that you need to put these patients on, for example, the lung environment, you need to put these patients on high flow oxygen rather than an invasive ventilator. So a lot of other things also became clear. Initially, people were running after HCQ, and a lot of even this time, I've seen a lot of people running after remdesivir. But after studying a lot of material available over the net and studying experts who have actually made clinical trials and compared uh, the various drugs. So what I found was that the timing of the treatment in COVID is very important. It is the first 8 days, which is the viral replication phase, where you need antiviral drugs. After the first 8 days of your disease, antiviral drugs are no value. And it is then, and then only the steroids and the ventilation, whichever form you choose for your patient, is going to help the most. The antiviral drugs like remdesivir and uh, Firapavir are not going to help at all. And what was happening in this pandemic was that I saw a lot of people running after plasma, remdesivir, purchasing remdesivir for uh, monumental amounts of money they were spending on just acquiring a single vial of remdesivir when remdesivir was ineffective because people land up in an ICU only after about 8 days of the illness.
Oh, yeah.
That is when the pulmonary phase starts. That is around day 8, and the intense pulmonary phase starts around day 12. So at that time, the virus is already dead in the body. You don't need antiviral drugs. So that is one thing which I came across most often. And serious patients, sick patients, dying patients, they were trying to acquire a vial of remdesivir, which was not going to help in any way.
Okay. This is a personal question for you. Initially, when you also saw there was so much happening around, not just in India, also around the world, did you have fear, anxiety related to COVID as you continue to go to your work? And you started also knowing how potentially dangerous it could be. How did you manage that fear?
Again, I would like to say that although I kept all my safety protocols in place, like wearing a mask, wearing a face shield over the mask, keeping distance even from my patients. I have not been physically examining my patients unless and until it was absolutely. I was not handling my patients, and if I had to handle a patient, if I had to, see something which I could not uh, see by observation or come across by the history, then I was washing my hands and sanitizing my hands after touching the patient. So those were the precautions. Yes, the fear was there, but again, pranayam helped me to overcome that fear.
Okay.
Pranayam helps you to stay focused and overcome any or all your fears. It helps to keep you calm. And keeping yourself calm and not panicking the is the most important thing which you can do.
Mm.
Because if you think that you are going to get sick, you will get sick. If you think that you are strong and you will not get sick, probably you may get the infection and you will not fall sick. It is mind over matter or mind over body. So you can control your body with your mind. If you lose hope, you have already lost.
Mm. That's a very good point. And how do you actually manage with patients who this is like a very new disease where people are actually separated from their families during their difficult times when they're sick? And you just mentioned that mind matters, and a lot of times that can be like the difference between having hope and not, because when people who are around when you have those difficult times, that can sometimes help people have faith that they can recover. But in a disease like this, like people are just separated from their loved ones, and then they have no idea if people can come and see them again or not. Is that challenging, or how do you think that rolls out in like a recovery process for a patient?
See, this is the biggest challenge in COVID, and it still remains till date, because a person who is not having COVID is not allowed in a COVID hospital. However serious his or her relatives might have been. Sorry, there was no way of finding out, because even if you would make calls, the only answer you would get is that they are still alive.
Yeah.
I mean, apart from that, there was no way of finding out exactly what treatment is going on, or uh, what is their parameters like oxygen saturation, what support mode and ventilation they were on, because there were a lot of patients, and the people looking after them who were supposed to answer our questions were wearing PPE kits with masks. They were putting their mobiles inside protective kits so that the mobiles were not contaminated. So it was very difficult for them to, answer each and every call. And wearing a PPE kit, you cannot talk, you cannot listen to what the other person is asking. Sometimes you would not be able to even hear the name of the patient you were being asked about. So just put yourself in a situation where you are in a hot and humid environment. You are wearing several layers of PPE kit clothing, which you cannot change for the next 8 to 10 or 12 hours. They were wearing diapers so that they would not have to go to the toilet, and they were not going to the toilet, and they were passing whatever they were passing in while doing duty. So it was very difficult for them to answer to each and every patient's query, and as many times as people would like to have, inquired and asked about the well-being of their loved ones. And yes, this situation is definitely new to everyone, not only the patients, not only the doctors, not only the healthcare workers, but to everyone. So we've still not come around in resolving how this situation needs to be resolved or dealt with in the near future.
Yeah. Um, Thank you. Coming to our last question of this discussion and wrapping it up, um, what is unique about this India COVID variant? And then what are some of the ways that you would advise people who are listening, um, that they can adopt to try to avoid catching the virus?
See, first of all, this is not an India variant. It is now called the Delta variant. And it was first detected in, I think, the UK. And it was found that it has the potential of very easy transmissibility,
Mm.
although it was also claimed that it is slightly less lethal than the previous variant. So the same, I think the thing we observed over here, that last time, if a patient in a family was infected and he was isolated or quarantined, the other members of the family were spared. But this time, if one member of the family had COVID, then definitely all the members in the family had COVID.
Mm.
And at least, I think one member in each family has visited the ICU this time. So, since our population is like 130 crores, even a small percentage, even if you are saying a small percentage will get sick, for us it turns into large numbers.
Mm.
It turns into very large numbers. So handling those numbers has been difficult.
Mm. Yeah. And any advice you would say, like people can, like some important things that might have become known over the course of time as we have get to know more about COVID, that people can adopt in their daily lives, which can help them avoid catching the virus?
See, there are only two things which you can do to avoid getting yourself infected. One is maintain social distance. The second is you wear masks or face shields. The third is you get vaccinated. Even after you get vaccinated, try not to believe that you have now become a super being and indulge in activities which might expose you in catching COVID, because we are still in the learning phase. We are still in the learning phase for vaccines also. We do not know what percentage of people who have been completely vaccinated are still prone to getting the disease.
Mm.
There, there are other things, there are individual things about the human body that we cannot know. Since this is one vaccination which is being done in the mass scale, and I think almost 90 to 100% of the world population is going to be inoculated somewhere around next year and a half. So the number of adverse effects, the number of vaccine failures which will come out will be far, far more than any other previous vaccine. So this is going to be a biggest educating point for doctors, for immune specialists, to find out where and how the vaccine works, where and how, in whom the vaccine does not work.
Mm. Yeah.
We are going to still, going through a phase where we will learn a lot of things. We will learn about the long-term effects of the vaccine, maybe in a few years to come. But right now, the important thing is to get vaccinated, because if you do not live today,
Yeah.
you will never find out about the side effects of this vaccine tomorrow.
Sounds good. And that's a great point too. So wrapping up the conversation, and just want to firstly thank you so much for taking out time and answering all the questions. I think it's very helpful, and I hope you continue to stay safe, and then hopefully all your patients also stay safe. Um, Thank you, doctor.
Thank you, Mudit.
Thank you.
Have a
Take care. Yeah, stay safe. Bye.